Ashley, did it work? Okay. Thank you everyone for joining. We're going to be starting in a minute. Okay. Ashley, can you hear me?
Yes. Can you hear
Okay.
me?
Yes.
Great.
Okay. Great. So I know we're waiting for more people, but we will start. The session's being recorded, so great. Excited. Okay, so just to start off, I'm Bracha Banian, family nurse practitioner and CEO of Ivy Drips, and I'm here with Ashley, family nurse practitioner and works with IV drips, but she also came to us as a patient for our weight loss journey and then eventually turned into one of our NPs. So she's going to share her story with us on her health journey. So thank you so much, Ashley.
Yeah, absolutely.
Both we get to have perspectives of you being a patient and the perspective of you being a practitioner. So we're really lucky to have you today.
Thank you. Do you want me to go ahead and share? Or do you want
I'm going to just go over a little bit of a background of these medications, what they do, how they help individuals, not only for weight loss, but what are the outside benefits that people are getting from GLP-1s. So I would say, what if there was a medication we all found out that not only could increase our lifespan, but also could increase our health span? We'd all want to know about these medications because it's going to help us optimize our health. We all want to optimize our health. We're all living longer now. And not only do we all want to look good, but we also want to feel good. So I want to talk about these medications. These medications are GLP-1s. And what are GLP-1s? I know there's a lot of different names. And just for anyone that joins us, make sure, just to let you know, it's all, your questions are all confidential. And so feel free to ask any questions and we'll answer at the end. So these medications, there's a lot of different names to these medications, and I just want to break it down so people understand a little bit more about what these medications are. We have Novo Nordisk that's in Denmark, and it makes a company, this company is making a drug called Ozempic. It's a very popular drug. The active ingredient of Ozempic is something called semaglutide. So most people know of these medications as Ozempic. It was the first one that came out, and it's owned by Novo Nordisk, which is in Denmark. The other medication that people know about is Mounjaro. It's made by Eli Lilly, and the active ingredient of this is Tirzepatide. So it's like a brand name versus a generic name, and the medication's active ingredients are either Tirzepatide or semaglutide. Novo Nordisk is in Denmark, and just to show how big this company has gotten, it's worth more than Denmark itself. Just shows how popular these medications have become over the past few years. Bloomberg put out an article this past year saying that the CEO of Walmart stated that he saw a decrease in sales in the food department due to GLP-1s. This is coming to show how this is not only affecting healthcare, but affecting economy as a whole. I'm going to talk a little bit about my story and why we got into the weight loss industry, and a little bit about how these medications work, benefits, and then Ashley is going to share her story. So about a couple of years ago, I gained 15 pounds during COVID. My entire life, I never struggled with weight loss. It was the first time in my life where I was trying to lose 15 stubborn pounds of fat. And even though despite diet and exercise, I was not able to lose it. I went on a GLP-1 semaglutide at that time, and not only did I lose the 15 pounds in 3 months, I also learned so many added benefits that these medications have. And through that, I've created a program not only to help patients lose weight, but also to sustain the weight loss and use this medication as a tool to get to long-term results. So how do these medications work? These medications affect different parts of our system, but in short, it one tells your brain to decrease the food noise. So when I think about food, how hungry, how many times I think about food, that's going to get decreased depending on how my practitioner doses me. That will depend on how much of the food noise I will continue to have. And it slows down our GI tract. When something slows down our GI tract, that means the food is sitting in our stomach for longer. And because of that, we are feeling full for longer. There's different added benefits that happen with these processes. So one thing I would say is that when something in your brain is like slowing down that feeling of I'm feeling hungry, what it's happening is you're also having uh, a delayed instant gratification with food or any other cravings, which I'll go into a little bit later, but also having real-time feedback about how your body's feeling with this, your stomach and your brain talking to each other. So, for example, I like to say a story of a gentleman that came to us and he said, I was so healthy my whole life. And then when I got to the age of 50, I started having this problem, this problem, this problem, blood pressure issues. And I said to him, it's really not anything that happened when you were 50, but it was more about how you lived your entire life until you got to 50. If we ate something that wasn't healthy for us and then the next day we had diabetes, we would all change the way we live our lives. What if you drink alcohol and 10 minutes later you were hungover? So we would make different choices in our lives if we had real-time feedback. What this medication does is actually gives you real-time feedback about how you feel and how your body feels. So it allows you to pivot faster. And we'll talk more about that later. And it also decreases your sugar spike. So by slowing down your GI tract, the food enters your GI tract at a slower rate. And that means the blood sugar doesn't spike as high because everything's going to your blood at a slower rate. So your sugar's not spiking as high. The reason why we care about these sort of things is because when your sugar spikes up high many times throughout your life, that is basically going to dictate how you will age. The more your sugar spikes, the faster you're going to age. So if you want to slow down your aging process, one of the secrets are slowing down your sugar spikes, that they don't spike as high and they don't spike as often. So these are a little bit more about how the medication works. And based off of what I just said, we're now seeing a lot of other benefits for these medications. Example, longevity benefits and helping with rheumatoid arthritis, helping with inflammatory disease processes, helping with OCD. I'm going to talk a little bit more about this, but I'm going to turn the table to Ashley. Ashley is a family nurse practitioner. She is on our team, but she actually came to us outside of being an NP. She was on a health journey and she found our company. So I'm just going to ask you a couple of questions. I appreciate you sharing your journey with us about your health journey and why you decided to go on GLP-1s. Can you give us a little bit of a background and just say hi to everyone?
Yeah. Hi, everyone. My name is Ashley. I am a family nurse practitioner, been a family nurse practitioner for several years now, and joined the IV drips team earlier this year. But yes, exactly like Brock was saying, I was on a weight loss journey. I similarly, had been active my whole life, had never really had a problem, being a good and normal weight for myself where I felt comfortable in my body. And then I turned 30 and I don't know why, but like she was saying, choices I had made up to that time or just my body changing, I couldn't get about like 15 to 20 pounds off. I had tried everything. I was also really frustrated with myself being active my whole life. I was like, I should be able to do this. I don't know why it's not coming off. I felt like I was doing the right things, felt like I was exercising and making the right choices. And so then I got to doing a little bit of research. And while being in the medical field, prescribing medications on a daily basis, I'm not someone that reaches for the medicine cabinet that often. So I think I was a little bit hesitant at first. Like if I have a headache, I'm going to push through it, drink some water, try to hydrate myself before reaching for that Advil. So was a little bit hesitant at first, but once I started the medication, found IV drips just through a Google search, honestly, reached out to their team, was paired with a nurse practitioner who really guided me through the program, and was able to have successful weight loss. And that was last February, and I've been able to keep this weight off for over a year and a half now. And even beyond that, really dove headfirst into the program where I was making sure I was doing the other parts of it that we recommend. So prioritizing my exercise, prioritizing, getting a nice amount of protein in for my body and my weight. And I think that's really important to helping me keep the weight off and even, losing more weight after coming off the medication.
Amazing. So what was there a particular reason why you gained the weight, or was just through time you just noticed you gained
You know,
weight?
I think it was one over time, but also as I was telling myself, like, oh, I'm active. Oh, I work out. Like, I really wasn't as much as I said I was. Like, we all like to think, "Yeah, oh, I'm active. I walk up and down the stairs at work." But no, I was not prioritizing, like, making those good choices, making healthy choices, eating, and I was not prioritizing my exercise. And I really think that was along with this medication to help give me the boost, slow everything down, stabilize my sugar spikes, which makes it easier to lose weight. But prioritizing those other things has really helped as well.
Okay. And how many pounds did you lose in what was the time frame? How long have you been on it? And
Um, in about 3.5 months, I lost 20 pounds, and then have kept that off, like plus or minus a couple pounds since that time.
amazing. What are the different techniques and things that you have learned during the time that you were on it that you were able to sustain while you're on it?
I would say for me, it was really, and as you mentioned earlier, that like real time feedback. Foods that I'm putting in my body is that just don't agree with me. Definitely while you're on the medication, it's easier to notice those. You're getting that real-time feedback. For example, like I remember the first time I ate something a little greasy after starting the medication. I went to a place with some friends. There weren't really many great options on the menu. So I was like, a grilled cheese sounds like my safest bet. Yet it was grilled and fried and butter and oil, and I felt so nauseous after eating it. So it's just, realizing things that you're putting in your body that may not be the worst thing, but just don't necessarily agree with you. And even don't agree with you now when you're not on the medicine, you're just not getting that real time feedback like you are when you do take the GLP-1.
Yeah. Okay. And what are ways that you've noticed that it impacted your life, aside from weight loss, aside from losing 20 pounds? What are the different things that you notice that it impact your life?
I honestly, I know one of the side effects can be the fatigue because you are in that calorie deficit. I actually had more energy while I was on the medication. When after I like had weaned myself off of the medication, I noticed I was like, wow, didn't realize the energy boost that I had while on semaglutide, that I was missing once I came off of the medication. It really did give me energy. And whether that was just based on the medication, a combination of prioritizing exercise and the medication itself, because I know we do compound our medication with B12. So a lot of our patients are B12 deficient. And so getting that extra, B12 vitamin in there really does help with the energy too. But overall, just feeling better all around, feeling better and more confident in my own skin too.
Yeah. And I will add that because your sugars don't spike as high when you're on these medications, that you're not getting those sugar crashes, which is what that makes us tired after eating. So some people do feel low energy maybe for the first couple of weeks, because again, their caloric intake may decrease, but after that, we usually do see a spike in energy, which is amazing. And when people are able to decrease those sugar spikes, they are able to see added energy. I myself also, I think I have more energy today than I've ever had. So, I mean, I've really learned to master my sugar spikes, which is amazing. Um, and as like a practitioner now on the team, what would you say are like the most common, um, what are the most common things that people are struggling with when it comes to weight loss? What are the most, what are you seeing when, a lot of times the stories are everyone has different stories, but there's
Mhm.
similar trends in terms of like when people are on this journey.
Definitely, and it's so relatable too, like having gone through the program first and then being on the other side of it, leading people through their weight loss journeys. Um, I feel like the most common thing, which this and across the board, it's pretty common, is the food noise, right? Like people getting home from work, their first thing they're gone all day working. They're like, "Oh yeah, I eat pretty well for breakfast. I have a pretty healthy lunch." The first thing I do when I walk in the door is go straight to the pantry or the fridge. I'm not even hungry, but I just start snacking, and then it turns into more than a snack. It's almost like a meal, and then I have dinner as well. And it's almost like we trained our bodies to go straight to the pantry or the fridge right after we get home from work. So this medication has been able to, help people turn off that food noise, really only, reaching for food when you're hungry and getting those hunger cues from your body and kind of break that habit of reaching for food at odd times.
Yeah. Yeah. Um, Thank you. That is helpful. I wanted to just discuss a few questions that people have asked, and everyone's welcome to just, there's a chat box, I believe, that people could just ask questions in. So, people want to know if you need to be on this medication forever. So, I just want to talk about maybe questions that but I'm sure you have these questions a lot of patients that come to the program and how how people are like on this medication and when you're starting to titrate them off different methods that you use, and we'll talk about it a little bit, but just a lot of people want to know, do I need to stay on this medication forever? So want to
Yeah.
just talk about that.
Yeah, I mean, and I think it's very individualized, right? You can be on this medication forever. We have diabetic patients that take this medication every single day for their diabetes and have been on it for years. But if you need it just for a period of time to help your weight loss and then you want to wean off of the medication, that's a great option too. And then there's also somewhere in the middle where we can titrate you to a maintenance dose where you're maintaining your weight loss. So there's a little formula that's very individualized and works. We can find something that works for everyone and what works best for you. I will say I've had patients that come off the medication and then we find that they want to start back, but they don't want to start back at their full dose and kind of want to transition to a weight loss dose because they do find those feelings of, wow, I felt like I had so much more energy, on this medication. I felt better overall. It was, you know, easier for me to make some of those great choices when I was taking this medicine.
Yeah. And I will add, I mean, we had a couple cases. Again, we do this uh, off label for patients because obviously a lot of people that come on our program are not diabetic. So people who are just dealing with OCD, uh, other conditions that people are looking to really just not only control the food noise, but the the instant gratification that people are trying to wean off of, let's say even of alcohol or sugar. And sometimes people just feel better on these medications. And then sometimes after a couple months of being on the medications, they're able to learn new habits. So a lot of things we do is using this as a tool to help you get to results, which is why we have such a high success rate in terms of sustainability. Because if you're using this medication as a tool to help you learn new techniques about how to optimize your lifestyle, then hopefully you'll be able to keep it off. It's like whatever you're doing on it, you should be able to keep doing it off of it. If you're using this medication 100% relying on it, then you're going to have a problem when you go off of it. So that titration process and dosing is so, so important. And it's really a key factor of success. A lot of patients that, I mean, I'm sure you've seen patients that come on the program that have already been on these medications have lost like 40 pounds over a whole year, but then they gain it back because they were not able to sustain it due to the dose being too high or not learning new techniques, not listening to their body in terms of the feedback that they were getting, and just taking Zofran as a band-aid instead of listening to what's happening. I'll just, let's say, talk about some questions here that we're getting. So is semaglutide or tirzepatide right for me? How do I know? I'll answer this, and then Ashley, like if you want to add anything. Tirzepatide I usually will use for someone who has chronic obesity, childhood obesity, has been dealing with obesity their entire life. It's a little bit of a stronger medication in terms of how it works. Semaglutide I like better for impulses. I like semaglutide better for alcohol craving, sugar craving. I, in general, like to start people on semaglutide. If it doesn't work, I'll move to tirzepatide, especially since it's a little stronger, tirzepatide, in terms of the weight loss. Ashley, any thoughts on that?
Yeah, I totally agree with you. I do the same thing. I always say, probably about 75% of my patients are on semaglutide, where the other 25% are on tirzepatide. Another reason I would start someone if someone with a larger amount of weight to lose front may be better suited for tirzepatide rather than someone that's just looking to lose like 15, 20 pounds.
Yeah, great. Um, So another question we had is, how do these medications help with longevity? So when we spoke about the sugar spikes, so one of the ways to slow down our aging process, and one of the things that are really going to predict how your health is going to be in the future, if you're able to like look at your sugar and how high it spikes, take a screenshot of your sugar live time and look at it on a trend, how your sugar spikes, how high it spikes, that is going to predict a lot about this person's health, right? So if I'm looking at someone's blood work and I look live time about their sugar, I'm able to say this person is going to age well, this person's not going to age well. We look at their blood work and how their sugar moves and their insulin moves in relationship to how they eat. And when someone's sugar is spiking really high, very often they are usually going to be candidates for diabetes, stroke, heart attack, hypertension. They're going to have multiple inflammatory issues. If you're able to decrease those sugar spikes, you're able to decrease inflammation in your body. If you're going to decrease the inflammation in your body, you're going to essentially slow down your aging process and live longer. Sugar and inflammation have are the root cause of pretty much every single cardiovascular disease out there. And if you're able to slow it down, then you're able to live longer. These medications decrease your sugar spikes, which decreases the inflammation in your body. That is why it is so effective and just so cool, because it's making these changes. It's curing diabetes. It's decreasing people's hypertension, which is a root cause of so many other diseases. I mean, decreasing cardiovascular risk, which means strokes, heart attacks, by going on these medications because of that decrease in sugar spikes and inflammation. And that's how it's helping with longevity. There are a lot of people that are on these medications now, microdosing, so I mean a slow amount, not enough to, let's say, cut down their food noise or their appetite too much, but really just to decrease those spikes, those sugar spikes, and that's going to slow down their aging process. It's also going to get you better skin because the more spikes you have, the more wrinkles you have. So, and again, this isn't something that happens overnight. It's something that happens throughout years and years of how we take care of our body. Okay. What is the usual start dose for semaglutide? Ashley, what do you usually start patients
First,
on?
we usually start patients on a dose of 0.25 milligrams. It's a weekly injection, so once weekly. And then after 4 weeks of injections, we typically go up to zero point 0.5 milligrams. And there's different ways that we talk about how much you get based on units or milligrams, but that's the typical like milligram dosing. That's what comes on the order form when we order the medication.
Yeah. And not everyone has, it's not the faster you go, the higher you go, the more results you'll get. I actually disagree with that completely. I like to keep people as low as possible for as long as possible because I don't want you to rely on the medication to get your results. I want everyone to learn to cultivate new habits and listen to their body. I always say, listen to your body, don't silence it because these drugs could silence your body. Don't do that. Listen to your body. Use these medications to listen to your body and not silence it. Um, and some people, honestly, I was on this medication for about 3 months. I never went up zero point 0.5 because I didn't need it. I was able to listen to my body by that dose, and it worked well for me. I'm on this medication. Can you give a diet plan? So, I mean, I will say a couple different things about how people should be eating when they're on this medication. One is increasing your protein levels, super important for muscle building. You're here. I mean, every part of your body, you need protein. Protein will help you feel full for longer. Always, I always say dress your food. So always eat protein fiber first before the carbs and sugar. And it's not about eating less, it's about eating right. So if you're not able to have enough food in your 24-hour day, then your dose is too high. So you have to make sure that you're able to have that 100 grams of protein and be able to have the nutrition and vitamins and supplements in your diet. Anything you want to?
Yeah, no, I totally agree. That's usually when someone asks me that when I'm doing a consultation with them is my exact answer. It's not about what you're eating. It's not about counting calories or a specific meal plan. It's about prioritizing the protein and striving to hit that goal and trying to get, minimum 20 grams of protein with each meal, trying to, 100 per day. And then, sometimes that's harder to visualize or to implement for someone that's never, really thought about tracking their protein or being cognizant about choosing items that are higher in protein to eat. So I have sent some of my patients like a list of foods and what their general protein amount is, and like a little, what could I eat in a day from this list of to try to hit that 100-gram protein goal.
Yeah, awesome. Very important. Don't underestimate the power of protein. Um, okay, so this question, I'm going to just touch on it really quickly. Why do prices vary so much from different companies? I can't speak in other companies, but I will say that one of the key factors in success in doing this, and I believe if you're doing it, you should do it right, is the dosing and understanding how to dose and again, not silencing your body and listening to it. When you take these medications and use it kind of off the shelf and aren't using it properly, then you may lose weight. In fact, most people do lose weight when you go on really high doses really quickly, although you're putting yourself at different risk. And it's important to really be the medications. The medication's long-term results really come down to the practitioner that's guiding you and the effort that you're putting into it. And so understanding dosing and having touch-based calls with your nurse practitioner to dose you appropriately is really going to define your long-term success. I mean, these medications are amazing. They do help people, but they also could harm people. When you talk about side effects and everything you see in the news, unfortunately, a lot of times it's about mismanagement of dosing, where people have stories about, my friend was sick to her stomach. She was, throwing up for months on it, or she has Ozempic face. She has this, her hair's falling out. Unfortunately, all of these things are not due to the medication, but it was how the medications were used. So if you're going to have extreme weight loss, you're going to have all of the side effects of extreme weight loss when it's not being used properly. So being guided by a practitioner is so key for success with these meds. If you want to add anything, Ashley, but I know you
Yeah,
agree on that.
totally agree. Exactly what you say. A lot of the extremes are because of incorrect dosing. And even sometimes, that's why we stress, the importance of even if it's a quick meeting, like once you receive the medication, a face-to-face meeting, let's make sure we're drawing up the right amount of the medication because we don't want you to, be giving yourself too much or too little. We want to make sure, the dose that we discussed is what you're going to actually administer for your safety.
Yeah. What advice, couple more questions. What advice do you have for someone who wants to convince a loved one to go on a weight loss journey with these medications? Hard to have this discussion. Um, that's a good question. I think understanding the benefits of these medications is where I would start. How these medications will help someone in their life. Not only will it help them lose weight, but it will help them feel more energized. It will add many years back to their life. They won't have to rely on food for those emotional impulses, because what the medication does is delays instant gratification, which is why it helps with addictive stuff. And so talking to them about the different benefits and the goals that they want. What are the goals that you want in your life, and how these medications could help you get there? I mean, do you want to feel more energized? You want to live longer? You want to feel more comfortable in pictures? You want to feel more confident in your body, which, isn't vain. People should feel great in their own skin, and helping people realize all those different benefits. It's not just about weight loss. These medications have, and we use this, prescribe it for so many other things aside from weight loss. I mean, I put people on it for fatty liver disease. I put people on it with actually eating disorders because it helps control their thoughts. I put people on it to help decrease their alcohol intake. People have gone in it because of rheumatoid arthritis, any inflammatory disease process, inflammation that's happening in your body. It will yield better results on these medications. So you have not only cardiologists putting people on these medications, but I see endocrinologists now, rheumatologists putting people on these medications now. So it's not just being used for weight loss; it's being used for many, many different things. And so understanding what their long-term results that they're looking for, I think, would be a good start. Pre-diabetic, which drug would you pick? That's a little bit of a hard question for me to answer, because I don't know if it's something that you dealt with your whole life or not. Both medications would be good for you. I'd have to understand a little bit more about your health. Yeah,
Yeah,
Ashley, what would you say?
I agree. I need more
Yeah.
information. It's really like a conversational, like, especially like when I'm doing my consultations, I get to know you about your history, about your life, your daily habits, and then we can make a decision. Both of the medications are effective, but it's really about figuring out which one's exactly, right for you. And, sometimes it does require switching from one to another to figure out the perfect formula and medication for you. But usually after that first consultation and conversation, we can really get you in the right direction of which medication would be best.
Yeah. Can it help quit smoking? Love this question, and the answer is yes. Semaglutide is a better drug. I mean, I prefer semaglutide for things like impulse. It does help with smoking, and it helps with sugar craving, and it helps with alcohol craving, and I'm going to explain why. So what happens is when we see something we want, whether it's a cigarette, whether it's a drink, whether it's sugar, a cookie, we see something we want, we have an instant dopamine release, an instant gratification, and that's going to make me feel good. That becomes our reality. You think that if I eat this, it's going to make me feel better. That is your truth in that split second. And what this does is it delays that thought process. It stretches it out. So instead of in 1 second, you're like, oh, I'm going to do this. It's going to make me feel better. I know that to be true. It delays that thought. So it delays instant gratification. So anything you get through instant gratification, which is so, so cool, which is why this drug is going to be used for addiction. When you're able to say, I see that, I logically now know it's going to, I feel logical. It's a logic, like logically, I know that maybe I might feel better on it, but like you're able to take your logic and your emotion and split that. So usually you see something and it's combined, and now things that you know logically, you're able to make a different decision because you're like, emotionally, I'm not attached to that anymore. I have this space of thoughts that I'm able to make a different decision. So that's kind of what it does. I like to describe it as what you always know logically, now you're able to act different emotionally because you're not acting on impulses, you're acting on logic now. And that's how it helps people change habits. That's how it helps people stop snacking. That's how it helps people say, I'm not going to eat this cookie. I'm not going to take this drink. I'm not going to smoke this cigarette, because what you always knew logically, you couldn't actually do it, right? We all know the things to do logically, but you can't actually do it. This medication delays that thought and allows it to become two separate things. So you're able to change behaviors. And that's why it's so cool. And you do this for 3-4 months, and that becomes your lifestyle. And that's how you have long-term results. Okay, I'm going to answer one more question. Anything you want to add on that about the smoking and the addiction?
No, I totally agree with everything you said. That was great.
Okay. How soon do you see food craving noise decrease after the first injection? Ashley, what do you see with your patients?
I would say, usually for myself personally, I could feel it pretty quickly or have those decreased cravings pretty quickly. I always say the most prominent side effects that I personally got and that a lot of my patients get are in that first 24 hours post injection, right? The side effects, sometimes are less and less throughout the week, right up until the time it's 7 days later due for that next injection, which is why we dose it every 7 days. But typically, doesn't take long to decrease that food noise.
Yeah. And again, not everyone will get to their dose right away. It could be that 0.25 is not your therapeutic dose, but it takes time to titrate up to the right dose. So it doesn't happen overnight. Rome wasn't built in a day, and it's also about habit building. So no one changes their habits in 1 week. Being on this medication long term, so 3 to 6 months, you're developing new habits, and that's how you'll be able to sustain it. If someone decreases your food noise and you're always full and you're never hungry for a full week, like, and you drop 5, 6 pounds, like that's not going to help you long term. Nobody needs that, and it's not realistic. And so that it should not be your goal. Your goal should be, I want to feel good, I want to look good, I want to feel better about my body, and this medication could help you do it. And then, usually we say 1 to 2 pounds a week is normal, but sometimes it takes about 4 weeks to get you to the right dose that is working for you. And that's okay because it's about habit building. If you're able to change your habits on these medication, that's how you'll have sustainable weight loss, but also sustainable energy levels and just feeling better about your body. And so, okay, I know we have more questions, but I don't want to run over time. Ashley, is there anything else that you wanted to add or say, or any
No.
success stories that you wanted to just share with us really quickly or
Yeah,
anything?
I mean, just bouncing off of what you just said about, it takes some time to find your therapeutic dose at points. I have people, and I always stress this all over the board. Slow and steady wins the race. We need to get there and work to get to a dose that works for you. And it's all over the board, right? Some people do start losing weight immediately at that low dose. Some people don't lose any weight those first couple of weeks. Some people lose a pound or two that first week, don't lose the second and third week, lose again in the fourth week. But usually, that next titration up, we see, most people are at their therapeutic dose.
Yeah, yeah, great. Thank you. Appreciate you, Ashley. Thank you, everyone who joined. Sorry we didn't get to all the questions, but we will do another one soon. Um, and thank you for your time. Appreciate you.
Bye. Thanks.